What's going on, y'all? Welcome back to another episode of the Struggle to Strength podcast, your source for real life application on how to turn your struggles into strengths in all things mind, muscle, and money. I am your host, Josh Levine, and I am joined here by my longtime friend and my co-host, Travis Hatch. And today we have Robert Yoho, retired physician and healthcare whistleblower who wrote Butchered by Healthcare, a book about medical corruption. And he is here to explain how sadly damaged our system is, how it works, and how patients can get around the problems. Before we get into it, we ask that if you love this episode, please give us 5 stars on Apple or a follow on Spotify. Share us on your socials. You can find me at Josh Levine Fitness, Travis at Travis Hawks Media. Links are in the show notes. Don't forget, you can also follow the podcast on Instagram. We've got tons of clips on there for you to check out. So go share them to your stories. We really appreciate it. You can find us at Struggle2 Strength Pod. That's it. Buckle up, get ready to learn what works, and see through the lies. When Travis and I were talking about you coming on the podcast, it came at a really interesting time because I've been so frustrated with the health and fitness industry that I'm in, and how closely tied some of the things are to the healthcare industry. And there's what's really infuriating to me is that the health and fitness industry seems to have been following this idea that maybe you might be talking about here in the healthcare industry, that there's more money in treatments than there are in cures. And people are being told that fat loss can be treated, and they're showing them treatments for fat loss and treatments to reach their goals, but no one's actually learning how their body best responds to different variables and stimuli. And so it's just this endless cycle of trying and failing and trying and failing. And it's really infuriating. So when we were looking at like our options to talk to you about, I was like, man, we got to have this guy on again. Cause right now I really want to hear about Butchered, but okay, you've got some stuff going on, man.
Yeah. I'll explain how it works and how all the pieces interlock and how it all fits together. And I'll explain why we're not focusing on good health practices.
Yes.
I mean, it's all about money. And the quote I always I like to use is Cicero: nothing is so strongly fortified that it cannot be taken with money. Right. So in other words, essentially bribery is going on all sides. Now that's a legal term. We can't really use that, but there are many, many, many streams of money that are interrupting the decent care and really interrupting the doctors and the healthcare system's ability to focus on the patient. So what happened was, as a well-meaning country, we rained money on healthcare, and we turned it into an industry that was literally twice the size of any other developed country. It's 20% of our GDP, twice the size per capita of any of Canada, Britain, France, Japan. They all have 10% of their GDP in healthcare, but we have 20. And not only that, our healthcare has been well documented to be 50% either ineffective or harmful. And this is not academically controversial, in my opinion. There's many, many articles that discuss that. So, the federal government is no bigger than our healthcare. So these guys are the biggest lobbyists in Washington. I mean, by far, they're the equivalent of any 2 other industries, such as banking and the military and oil and natural gas. They're twice the size of these things because they're such huge. It's such a huge amount of money, and we rain money on them, and they spend it influencing the process, and it's kind of a vicious cycle. So I can launch into how the pieces interlock, or you guys can hammer me. So go ahead if you want.
I think I would love to, if you could launch into how all the pieces interlock. I'm sure we're going to have questions as they come up. And I know it's everything from like upcharging for services to treating like we were talked about instead of curing. And there's massive, there's just massive profitability when I believe there doesn't really, it's excessive. It seems excessive.
Do you want to give a, like, we'll have your background and everything in the show notes, but do you want to give a little bit of your background and how you got to where you are now?
Okay. So let me do a disclaimer first. And I'm forced to do this by our legal environment. And that is, this doesn't represent individual medical care, and use this information at your own risk and all that stuff. It's, if you're sick, find a licensed provider to help you with it, and don't listen to this. Okay. So sorry, I have to do that. Everything I say, I believe.
Protecting us.
And it protects you guys too. My background is interesting. I worked for years initially as an emergency physician, and then I became a cosmetic surgeon. And everybody in this space says, what the heck is a cosmetic surgeon doing talking about medical corruption? And the way I got into it was, this is a little circuitous, but bear with me for a second. As a cosmetic surgeon, I mainly took care of women, and a lot of them were postmenopausal, and they were being driven crazy by their menopauses. And so I trained, and for 15 years, I treated my patients with bioidentical hormones, and I saw fabulous results. And we can talk about that some other time. But most plastic surgeons treat a series of depressed and anxious and women in menopause with the surgery itself. And sometimes this even works, but it doesn't work as well as giving them hormones. And I couldn't, nobody could afford, they pay the money for the surgery. They couldn't afford this other stuff. They paid for their health care. And I just would supply them with testosterone pellets for free, so they could get a feel for it for 3 months if they were interested. I never try to sell anybody on any of this stuff. I mean, if a person is already sort of red pilled on it a little bit, they're into it. And so I saw marvelous results, and I was interested in that, but there were so many false narratives in hormone therapy. We had these black box warnings on these darn things by the FDA that said they caused cancer, heart disease, strokes, and all this other crap. Excuse my French. But it just wasn't true. As I got deeper into the literature and understood more and trained more, I understood that there was false messages going around, and I wanted to unravel the mystery. So first I looked at the hormone therapy, and then I gradually got into healthcare, and bit by bit, I unraveled the ball of wax. And I thought I was going to find a can of worms, but I found a dumpster full of worms. I mean, it was just incredible. The whole thing is corrupted by the massive amount of money, and our original ideals as physicians to attempt to put the patient first are corrupted by these sources, and there's nothing so powerful that can stand against that money, as Cicero says. I mean, you can't be objective if you're making several $100,000 a year more from some source of income. And I'll get into examples of all that. So step by step, I looked at everything from generic drugs to the insurance companies, to the hospitals, to the different medical specialty fields that had been most corrupted. And then I developed some ideas for ways that we could tune this stuff up. But at the bottom of this is a couple of fundamental pieces that I can explain. First of all, there's this FDA, right? And it supposedly helps us get better results from our medical, from our prescriptions and from our food sources, right? Food and Drug Administration. But it turns out the FDA is one of the very most corrupted institutions in the U.S. government. In a government that's a mess, this is arguably the worst. And the problem is that since early 2000s, around 2003, the FDA has been paid directly by these pharmaceutical companies by user fees, which are a fee that is generated during the patent application process. And it's well over half of their income, maybe 2/3 of their total $5 billion in revenues. Now, that sounds like a lot of revenues, but they are trying to regulate industries that are in the trillions, $4 trillion for healthcare alone, and the pharmaceutical companies, and God only knows what it is for the food companies. That's what they're charged to regulate. So they're paid directly, and they're essentially have become entirely a creature, and that's a legal term, but I believe it's true, a creature of big pharma. And they are essentially part of the marketing arm of Big Pharma. And nothing that you hear with the FDA stamp of approval on it probably makes any sense outside of the economics of the situation. So that's a mess. It's a mess. The FDA was originally did a lot of good. They still probably are protecting us from terrible drugs that might be imported from China and India, but they don't work well. And the pharmaceutical companies have had more criminal settlements than any industry in history. Now, just think about that for a second. It's billions of dollars a year. They essentially pay off federal prosecutors not to be hassled. They never admit anything, but they're where there's smoke, there has to be fire. And this is a lot of smoke, billions of, and many of these companies that we're dealing with right now with some of these most current issues, they're among the worst. They've paid the most in federal settlements. I mean, $3 billion a year, so $3 billion in one settlement sometimes. I mean, it's crazy. The journals and the editors of the medical journals, they are aggressively paid off by Big Pharma. They make each journal editor makes $300,000 to $400,000 a year in direct payments, and the whole thing is the journals are 95% ghost written by industry sources. The studies themselves are adulterated with fake statistics and putting patients in the wrong group. And they use contract research groups from other countries where if they don't produce the result that they want, they never use them again. And they hide papers. They hide, for example, the HPV, which both of you have had, which is the wart vaccine that supposedly prevents cervical cancer. 50% of the studies were hidden, and we have no access to them because in theory, and this is the way the law works now, in theory, they own the studies. And Japan threw that drug out the window. In Europe and the US, it's used ubiquitously. For whatever reason, we're more under the thumb of these industries. So one other part of this that I'll ramble on about for a second, and then you guys can hammer at me, is influence theory. And you probably have heard of Cialdini. He's a University of Phoenix professor. And that's his book, Influence, explains how it works and how irresistible even a meal is. It's a biological imperative. If you treat somebody to a meal, they owe you something. So if you treat somebody to half their income, or you can kick them back 20% of the drug's cost, as happens in cancer therapy, you have them. And they essentially have to do what you tell them to do. So that's the kind of broad background, and you go where you want from here.
Man, this is resonating on a lot of different levels and things that I've personally, without doing the in-depth research that you have, I've kind of felt this way for quite a long time. I feel like I've been able to see through some of the things that you're mentioning here, and of course, yeah. Corruption is going to exist, and when there's massive amounts of money and huge margins, it's no wonder. It's surprising that people think that it's not happening.
Let me address the margins, and this is something that's stunning. Ordinary industries are very profitable at 10% profit margin. These industries have at least 25% profit margins, and the hospitals, which are 70% nonprofit, they use this massive influx of money to buy other hospitals and other practices and all this other stuff. The pharmaceutical companies, there's one of them with 5 years in a row of about 50% profit margins. I mean, that's a badge of something, and I won't say what it is, but it doesn't strike me as healthy or credible.
Yeah, I think Pablo Escobar had 50%.
Yeah, Pablo Escobar.
Walmart has a 1% profit margin by comparison.
Two of these commentators, these critics and whistleblowers of this industry, have both called the pharmaceutical company mobsters, or they said they behave like mobsters. And these are Peter Gurcha, and who is the founder of Cochrane Research, which is one of the most respected sources of medical information in the world, and another whistleblower named Peter Rost, who worked for one of these companies for several decades.
Mm-hmm. I have a question for you on, you mentioned that we only have about 50% of the studies that were conducted on, I forgot what
HPV.
it was. on HPV.
Human papillomavirus. Yeah.
Yeah. So if we only have 50% of the studies and the others, I assume, have been hidden, have been banned from the internet, have been unable to be found, does that happen often? And when those studies are hidden or suppressed or somehow withheld from the public, does the government slowly end up releasing information as they see fit so that they can control the narrative?
Well, you know, they're the academics who examine the situation. And if you're interested, one of the best, there are two books about this that I reference in my Butchered by Healthcare. One is called Bad Pharma by Ben Goldacre. And the other is called Pharmageddon. It's a very clever name by Healy, Healey. And these guys say that and they have suggested that we keep data banks of every study always. But getting that sort of thing through a Congress that's completely dominated by lobbying dollars from healthcare and big pharma is well nigh impossible. So there's no check and balance here. Right now, the only check and balance is the FDA, and they are the federal prosecutors, and they are essentially, they don't take anybody to trial. Other observers have said that if we broke apart one of these companies, the others would take heed. You know, it's like kill the chicken to scare the monkey, the Chinese thing, right? But the only pharma companies that have been broken apart not by federal prosecutors, who it's hard for me to believe, but they're weenies compared to the plaintiffs' lawyers. The plaintiffs' lawyers took apart Purdue and one other opioid company, and they're bankrupt, and they're chasing around their owners for more. You know, which I think is fabulous because those guys are mass murderers. I mean, they essentially sanctioned this narrative that their products were not addictive and not a problem.
Mm-hmm.
Yeah, there was just a documentary on Netflix, I believe, about that, or HBO. Did you know what I'm talking about?
You know, the story about the opioids has gotten out, and most of the rest of the story hasn't. And so it's politically correct to talk about how bad the opioids are, because the fatalities have still gone up every year. I mean, I think it's 68,000 overdose deaths last year, and the year before it was 55 or something like that. And then it went down from there, but it's still increasing, and we don't have a handle on this thing. And it may just be that COVID made it worse, but opioids are the devil themselves once we get a large swath of the population addicted to them. And what Purdue did in cooperation with the big wholesalers and a few other players, they essentially exposed the whole population to these drugs. And 5% of us are vulnerable. And the rest of us, like, we could take it or leave it. But that 5% or whatever it is ruins their lives. They're forever addicted to it. They struggle with it indefinitely. And I mean, it's just a mess. It's a social ruination beyond anything we've ever seen. The deaths are just the tip of the iceberg that we can measure.
And that was placed upon us by the healthcare industry.
Well, it was placed upon us by the permissive nature of what we allowed these private, and Purdue, my God, I can hardly stand to say this. Purdue is privately held. It was a several billion a year, maybe $5 billion a year revenues. It was held by one family. It was not a public company. So the oversight is essentially nil. So what happened was they manipulated, or they took advantage of a situation where there was a permissive academia who said that we were too conservative in our response to chronic pain and to acute pain. And then they started advertising this drug, what was the name of it? OxyContin, as being safe and effective and not addictive. If you can imagine, this is a big time opioid. And, pretty soon we got all these kids breaking it up and sniffing it and stuffing it in various orifices. And then we crack down on the doctors, and the black tar heroin from Mexico takes over, which is cheaper, I mean, they were selling this stuff outside. At first, it was the pain clinics for 10 or 15 years that were passing this stuff out to anybody with a freaking mouth and a checkbook, and an excuse, they got a headache. And then we crack down on these people, and the drug sellers outside these clinics suddenly become more attractive because the drugs are, the prescription drugs become expensive, where they should be expensive and they should be locked up. So we've kind of corrected the doctor problem in a lot of ways. The doctors are afraid to prescribe this stuff, perhaps even too afraid, because they are tremendously valuable for cancer and severe post-surgical pain, acute pain after some accident or something. I mean, they're valuable, but they have to be watched. Mm-hmm. And those people in practice, like me, saw many, many patients who were ruined by careless prescribing. I mean, some doctor would prescribe something after a surgical event, and his office would go ahead and renew the prescription for 3 or 4 months. And by the end of that, the patient was just completely addicted. And, some of them managed to get themselves off. I saw these people, and I mean, these stories are just pitiful. Mm-hmm. But that's a privately held company. And another fellow from another one of these companies, I don't know how they got him. He's a billionaire, but they put him in jail for a long time. Apparently, I don't know. He may be out by now. I'm sure if you got money, you can turn any wheel you want.
Yep, all comes down to
Kapoor,
money.
Kapoor, I think that was his name.
Mm-hmm. I find it interesting because, like you said, the drugs are very useful for certain people. And if you've ever been, I've been like injured or post-surgery before, where I'm in excruciating pain, and used correctly and with the right dosages for the right amount of time, it's like, it's a miracle drug, literally. It can save you so much like anguish. So it's like, I always find it interesting how everybody wants to be like, oh, here's a problem. There must be like an evil reason, there's got to be evil behind that. But in reality, it was like a drug created it's just a molecule created to help a certain situation, which it does very well. And then the money just slowly just slowly causes corruption.
Opioids are well over 100 years old. They're originally poppy plant derived, and they're nothing new. This was a synthetic opioid that they promoted it in this way. But everybody's aware of that story. I've got a lot of other stories that the doctors don't even seem to understand it, and I didn't understand it. I mean, I'm like Rip Van Winkle, guys. I just kind of went along with my practice. It's very consuming, and then I kind of got jolted out of things and retired. And I started looking into all this stuff, and I mean, it's incredible. Mm-hmm. But we can chat on about other corrupt areas in healthcare. I mean, it just goes on and on.
I think that would be very valuable. I mean, we're talking about how much control the government, and specifically the FDA and these large entities with tons of money, have over narratives,
that's a good way to put it.
Yep. Over narratives and over what we encourage the general population to do. And so this is a very interesting time to be having this conversation.
No kidding. And it doesn't sound like I'm going to have to red pill you guys on anything.
Nope. Not me.
Hey, so let's go into a few standard healthcare conflicts of interest. Now, they call these things conflict of interest, and actually that's the kind of sanitized word for bribery, right? And in other fields, in government and in law, conflict of interests are forbidden. And if you have a conflict of interest, you can be prosecuted criminally, and you certainly can lose your job, right? But in healthcare, you just supposedly can disclaim your conflict of interest at the end of the paper, and everything's like sanitized. Well, it just isn't so, because the power of the whole thing is so profound. And oncology or cancer therapy is one of the most shocking examples of this. So well over half of the income of oncologists is derived from retailing chemotherapy drugs. Now, just let that sink in for a second. That gives them the motivation to use more expensive drugs, to use more drugs, perhaps even do something inappropriate. Now, I want to say from the outset that I greatly respect doctors. We're an idealistic bunch. We have been twisted by all this money and all these corporations to behave in a certain way. And if I were an oncologist, I'm sure I wouldn't be able to resist any of it. And I would do my best for my patients and so on. But the story gets worse. They are sometimes incentivized by the milligram. So they call, the drug rep could call you up at the end of the month, 2 days late before the end of the month, and say, look, you're at 2,400 milligrams. You get up to 2,500 milligrams by giving it to somebody else, you're going to get your bonus. Can you imagine a situation like that? So, the financial things, if we three were doctors and Travis had a product and he told the other two of us to sell it and get 20% off the top, that would be called capping if we three were doctors. And that's a federal crime. You can all go to jail if anybody finds out about it. It's often done with cash, so it's not as much of a problem. So the oncologists, they take 20% of all the drugs they administer in their office, and that constitutes well over half their income right now, which incidentally has been going up. It's been skyrocketing. These guys are doing very well. It's their cardiac catheterization. It's their gallbladder surgery. It's their hemorrhoidectomy. It's the equivalent of a large charge, and their goal many times in private practice is to get a batch of people in a room with Barca loungers, right? The little recliners, all hooked up to chemotherapy every day. And it's like a chemotherapy farm where they get 20% off the top. I mean, it's absolutely crazy that we allow this. And anybody that understands it, and not many people do except for the oncologists, anybody that understands it, I believe, would consider it outrageous. Even a fee for service is a big conflict of interest, and a surgical fee is a tremendous conflict of interest. And I did this. I was a cosmetic surgeon. I mean, the surgeries were in the thousands, and the overhead was 75%. So you have to charge them this much to make any kind of money. And there was always a temptation to push the indications for surgery, and you do your best to be ethical. But it's, for anyone with a financial conflict, it's very hard to separate out your interests from the interests of the patient.
Mm-hmm. Is this like an American problem, or in countries where, because of our healthcare system, or in countries where it's like, the government pays for the healthcare? Are they seeing the same things? Is this like a company problem or a government problem, I guess?
Well, Travis, that's a great question. The U.S. is a perverse blend of capitalism and socialism in our healthcare. And I don't have a magic wand, and I can't tell you whether Medicare for all or one of these completely socialized systems would be more advantageous, but it certainly would cut down on the costs. And I mean, do we really have the money to put 20% of our gross domestic product into healthcare? I mean, we've got our military, we got our healthcare, we got our deficit. It's just crazy. So the answer is that we have three different systems run by our government that none of them work well. One of them is called the Veterans Administration, hospitals, right? One of them is called the Indian Health Service, and the third is Medicare. And all three of them are a mess. And whether we'd be better off if we could adopt Singapore's system wholesale, where they have some sort of dictator in charge of healthcare, some sort of, in theory, benign. We might do as well as they do and get our healthcare down to 5% of our GDP. They have very successful healthcare from everything I can see, and they have their doctors and their systems under control. We have another system where we bribe our Congress and they do whatever we want. That's the deal.
And do sorry, Travis, I was wondering if other countries have as much of as many other companies in the industry that are government funded. Is that part of the problem?
Well, stories about Britain and the drug companies are horrible. I mean, we can talk about antidepressants and psychiatrists, but one of these antidepressant companies threatened to pull out of Britain, and it was apparently the largest industry in Britain, if they did not approve their new antidepressant, right, a few years ago. So these companies are, the 10 largest pharmaceutical companies together are larger than the, all but the top 20 countries. in terms of gross product, gross domestic product compared to gross revenue. So these people are phenomenally powerful, and they're not shy about throwing their weight around. I have a friend in Holland who was collaborated on this book, and she said things are not great there because they're not even allowed to change doctors. That's what she said. Now, I don't know whether it's true or not, but she thought there were some aspects to our system that were better. And indeed, I think that if you can afford to pay for your healthcare insurance, which, for you guys, if suppose you make $50,000, you probably understand that 10,000 of it goes directly to healthcare. I mean, whether the company pays it or you pay it, it's just insane. I mean, it's such a big bite out of your backside that you can hardly believe it. And I mean, people on a wage, they think, well, the company's paying for the healthcare, so I'm fine. Well, it's not true at all. Everybody pays for it. So anyway, the answer is I focus primarily on America, and I don't know as much about these other countries. I do know that some of these other countries have rejected many of the things that we find standard because they didn't believe the numbers. Mammograms have been rejected by France and Switzerland. Now, mammograms, it's a feminist issue, right? It's like mom and apple pie. You ought to do your mammogram, dear, every 3 years or whatever the heck it is. But the numbers don't really work. The mammograms create a cascade of other services. Now, I'm not saying, that sometimes even cause fatalities, another little surgery or another this or another that. And many of the things that they pick up involute or go away on their own. So the mammogram numbers don't work. Some of the most astute commentators don't think they work, and other countries have rejected mammograms as a screening tool, right? But if you have a breast lump, or if you've got blood coming out of your nipple, or some other pain in your breast, something, mammogram's a reasonable step, but that's a diagnostic aid rather than a screening aid. Similarly, colonoscopies as a screening aid done, and these guys, the joke that they make in their in their surgical scrubs is they're up there to extract the $1,500 bill from the end of the colon with a scope. Can you imagine? That's their joke. It's a true story, and they tell it to the nurses. My wife was a GI nurse at one time, and the screening colonoscopy is probably a net break even or loss. Whereas if you have blood coming out of your backside, or you have abdominal pain, or you have some reason to get a colonoscopy, the yield is high. But for these other guys, it's like there's a small chance they're going to, one chance in 2,000, they're going to perforate the colon, and one chance in 10,000, they're going to kill you with a procedure. It's not inconsequential for someone who doesn't have a symptom or a reason to do it. So we're doing a lot of screening, and we do a lot of therapy, preventive therapy that just doesn't work at all. I mean, I can go on and on and on about this. 10 seconds more. We have these drugs called bisphosphamides to women who have this made-up diagnosis called osteopenia, which is supposedly a step to osteoporosis. The bisphosphamides causes jawbone rotting and femur fractures, and they're probably a total wash. And I mean, that's a tens of billions of dollars industry. Mm-hmm. Statins are another one. The drugs for cholesterol.
Mm-hmm. I'm hearing a lot of numbers that are probably alarming to some people to hear, as far as these are either like screens or elective procedures, or they're choosing to use medications or pharmacology that has a pretty high rate of return on addiction, such as opioids. Why we're in a time right now where, a year ago, people were really worried about a survival rate. And it seemed like it was really scaring people. Why aren't people more afraid of this?
You mean, why aren't they afraid of COVID?
Why aren't they afraid of the high percentage that of likelihood that there's going to be something wrong that goes wrong in a screening, or an addiction to a drug that they're going to take? Why are people so willing to just do what they're told?
Well, there's a number of reasons. I mean, this is another great question, as who knows about this, and how do they know? And I got to admit, I'm a pretty smart guy and I did a lot of medical reading, but I didn't understand these numbers until I started like concentrating on it and reading about it. And I've done it for 4 years now. I have a basic grasp, not a statistician's grasp of the way medical numbers work. But the doctors don't understand a lot of it. And, patients have a need to simplify things. Now, prostate cancer is a great example. If I told you had prostate cancer, your reaction would be cut it out, right? I mean, it's like cut it out, right? But the thing about it is prostate cancer happens in probably 80% of us by the time we die at 80. And it's only fatal in 2%. And there are treatments after it's metastatic. But the treatment for early prostate cancer, the way we've done it is we check this thing called a PSA or prostate. So we check that. If that's elevated, then they do the biopsies and then they cut out the prostate if their biopsies are positive. Well, we've got this group called the USPSTF, United States Preventative Screening Task Force. And they initially said never to do another PSA for screening because it created too many opportunities to do this radical prostatectomy. Now, what's so bad about cutting out the prostate, you ask? Well, have you ever seen those advertisements with those rough-looking guys who are it Depends diapers advertisements? They're kind of tough-looking guys on the. You know what that is? That's all about wearing a diaper after you've had a radical prostatectomy, because 20% of them are permanently incontinent. I mean, it's amazing. 20% up, roughly. This is crudely. 20% are impotent and 20% are incontinent. And what's worse, Josh, is it makes your penis shorter. I mean, I know that sounds like a joke, but it's not a joke because it cuts a hole out of your backside right below your testicles, right? And so a radical prostatectomy, in my view, is something that it's an art of medicine thing. It should be done selectively instead of for anybody with a positive biopsy. And they talk about these younger guys. I mean, I'm sure I've got prostate cancer. I'm 68 and I've got 68% chance of having it. And I'm not going to check my PSA anymore. I'd be an idiot to do that. The next thing you know, I'd be thinking the thoughts that go through a patient's mind, cut out the cancer, and not considering what the chances are. I mean, we all get old and die, and most people die with the prostate cancer. So this is a hard concept for most people to grasp. And I mean, I don't blame patients, and I find it hard to blame doctors because I didn't understand it that well. I mean, these things are all math problems they're fairly simple, but the doctors are so consumed these days with all the stuff they're doing. I mean, you can't imagine what it's like, Travis. You're busy patting people on the back and trying not to make any mistakes and trying to do whatever you're supposed to do. And then at the end of the day, you spend 25 to 50% of your time clicking on a computer so you get paid. That's the Affordable Health Care Act medical records requirement for Medicare. I mean, it's a crazy scene. So, there's a lot of things in play, Josh, that keep the patients believing in the whole system. And it's hard for anyone to grasp the actual math of all these things.
Mm-hmm. Well, it sounds like it's the patients and the doctors that are believing in the system, but clearly it seems like there's something wrong with the system. So what is the solution and how do we regain control of the truth, the narrative?
Well, we're jumping right to the punchline, and I don't mind a bit, but let's jump into that.
We can take it slow.
Yeah, no, it's okay.
We got more to cover.
It's your job. It's your job to ask me whatever you're interested in. So the answer is that there are things that would help slow the whole thing down. And I put my ideas down in the book, and I'll tell you a few of them, but they can never, ever get past the money. They're not going to get past Congress or anything else. If we, for example, got rid of healthcare patents and the drugs there wouldn't be this incentive to disease monger. And that means make up things about a disease and frighten people like we've seen with COVID. Right? Mm-hmm. There would be no incentive to disease monger, and there would be not an incentive to fabricate new drugs for crazy things that barely work or don't work and sell those things like you're selling mom and apple pie. There wouldn't be an incentive to do that, but that's never going to work. taking the drugs off prescription. That's been done in other countries, and that slows things down. That's not going to work either. But the real solution for patients is, number one, to research your local healthcare system, know what is covered, and understand what's going on before you get sick, if possible. And if you have a close friend who can be your advocate during a period of illness, and especially for complicated problems like cancer or other issues that are issues of aging, you really almost need physician level expertise to navigate this system. I mean, it's crazy. But there's another couple of important hints I can give you. And one is, take advantage of the patient advocacy groups. Okay. There's one for every disease, or maybe 5 for every disease. These are largely sponsored by drug companies, but they still have exceedingly sincere people in them who will help you and tutor you about your individual situation. Some of them seem to know more than the doctors. The number 2 thing is, you can consult now after Trump's executive order last year. You can consult with any doctor you want who agrees to see you. And so if you have a few hundred or a few $1,000s, you can get a second opinion online or in a virtual consultation. No worries. Prior to that, the medical boards would censure these guys if they didn't do a quote good faith face-to-face physical exam sort of thing. And it makes sense, but not in an internet age. We have to accept the limitations of these ways, and it gives you a lot of versatility. And the bottom line is, if you're not getting better, if you don't feel good, you probably want a second opinion, or you want to at least tell your doctor and see if they can improve things. That's your most robust method of telling if you're on track, is if you feel better.
Mm-hmm. Yeah, there's a few kind of like analogies I thought of when you were saying that, but I think people have, I think it's a cousin of imposter syndrome. We'll just call it like expert syndrome, where they see like, oh, there's the man in the lab coat, or there's the man in the police uniform, or, there's the guy standing in the president's thing. Like, that guy knows everything. He knows what he's doing. Like, he's going to save us because he's the expert, right? But like, think about it for yourself. Like, if you're listening to this, or anyone, like, if you've been, let's say you go to business school and you're like working your way up in a company, like, do you know everything about everything that's involved in business and taxes and then the legal side of things, and you only know like the thing that you're doing. And I think like that's basically what you're saying. Like, people want to just rely on this expert, but like, they're a doctor expert. Like, that doesn't necessarily know that they're going to know everything about, all the whole other side of thing and what's going on. They're also kind of being told by another expert that they're kind of relying on. And then there's like a whole other side of it, which is, and that I wanted to ask you, like, how much you think this has to do with it. But like, I would assume that, you're getting out of school with a ton of debt, and these guys are the ones who are like paying your debt off, basically. And so, how much does that have to do with it? Like, if people are like running their practices and they have like tons of debt that they owe every month, to hit these quotas.
Well, there's no doubt that you get sucked in and locked in financially. I'm in a different generation. So my father paid most of my school. It wasn't that expensive. It was a nice university and so on and so forth. But now, I mean, they are debt slaves, and it's not a healthy thing.
Yeah, I think people are coming out of medical school with $250,000 in debt or more. And
crazy.
And then they're taking on a job that, depending on what type of work you end up in, or what field you end up in, you're not making $250,000 a year most of the time. It's going to take a long time to pay off. So I can imagine that, of course we know that money is incredibly powerful. And I can imagine that the manufacturers of some of these products, or anybody who is pushing for any sort of outcome, it's going to throw money at these kids who are just getting out of college.
Yeah, the medical schools are actually largely paid by pharmaceutical companies.
Really?
They're funded. Yeah, they're funded by pharmaceutical companies.
So these are those pharmaceutical companies like, are they Are the majority of them, would you say, are they I don't know if self-funded is the right word. I know a lot of them are government funded.
Well, when you sell a drug that's paid for by insurance and you charge $1,000 a month for it, that's a nice source of funding. When you can charge $600,000 for a drug that is administered over 4 weeks, that's a nice sort of funding. So yes, they're either the drugs themselves are either reimbursed by insurance companies or the federal government in the Medicare and the other programs. And so they're all third party paid. So the pharmaceutical companies are the beneficiary of our collective largesse. I mean, it's crazy. Mm-hmm. They go ahead.
I was just going to ask if by chance you knew if Pfizer and Moderna, the companies who came out with the vaccines, are all of them government funded?
Well, any pharmaceutical company that has a patent drug, see, the patent is an exclusive right to sell that drug for a high price. Mm-hmm. And especially when a drug is claimed to be life-saving, they can get almost any price they want. So every drug company is funded by our government, sometimes directly, as in the case of this vaccine, quote vaccine. It's not a vaccine. It doesn't confer any immunity, but they're all funded indirectly. Now, if you go to Wikipedia and you Google or you search for pharmaceutical company settlements, you'll find every major pharmaceutical company there with billions of dollars of settlements every year. So it's like a little page of shame. It's very easy to find. And that's the basis of my claim that they have more federal prosecutor settlements than any industry in history. I mean, name another industry that's settled, $3 to $5 billion worth of claims every year, nearly every year. It's crazy. But they're allowed to go on and play the same tricks next time. Here's a quote from the CEO who was responsible for chloramphenicol, which is it's a very good antibiotic. The only problem is it occasionally kills a kid, right? He said, and they obscured the studies that showed this stuff until it went off patent. His name was Harry Loynd, Loynd. He said, if we put horse manure in a capsule, we can sell it to 95% of these doctors. That's their attitude towards us. And look, I had a wonderful medical career, and I don't want to say that we don't do miracles in medicine. We do every day. And it's shocking sometimes how well we can do with certain kinds of problems. But in the case of cancer, we have only about 5 or 6 things that we can treat effectively. The rest of it, on average, is a 2-month improvement in survival for all the expense and the hassle of the chemotherapy. True story. And that's academically incontrovertible,
Mm-hmm. Wow, that's wild. So what are those 2 forms of cancer that we're certain on?
Well, we're never certain on anything. And the cancer doctors have a difficult job. They treat people who are undergoing these death and dying changes sometimes. And I mean, these are the most stressful moments of their lives in sometimes. But the things that we can treat well are some lymphomas, some leukemias, some testicular cancer. Remember, Lance Armstrong was cured from his, mm-hmm. and a few other things. But the rest of it is, I would characterize it as a total failure. I mean, but again, things are coming out every day, and there are a lot of expensive research because we fund these things with we allow them to have patents, and then they make up the price on their own.
Mm-hmm. And is that kind of a little flip side of it though? Do you think because there is so much money, we've been able to create a lot of things that, at least to me, as someone like totally on the outside, is seemingly like a miracle in kind of a short period of time? Like, how many things could you have died from, 100 years ago that are just like, you don't even think about it anymore?
Well, all that's true, but the question is, can we afford any of it? And the answer is running a deficit like this and so on. I mean, it's going to implode. I hope it's not too soon, but it might be next week. And there has to be some sort of governor on it. I mean, it's crazy what's going on. And the vaccine narrative is the craziest part of the whole thing. Mm-hmm. I've got other specialty fields I can discuss. I mean, psychiatry is a mess. Do you want to hear about that?
Sure. Yeah.
Okay.
Yeah.
So psychiatry is the only field in medicine where we have quote, psychiatry deniers. And psychiatry deniers are psychologists and lay people and journalists and an occasional renegade psychiatrist who believe that psychiatrists should not be in business at all. Basically, they're doing much more harm than good. So the problem, as has been pointed out, is that the drugs that they use have never been subjected to decent double-blind, placebo-controlled, sugar pill-controlled trials. In other words, they're just a bunch of opinions by the psychiatrists, whether they work or not. So the 4 or 5 classes of drugs they use are tremendously addictive. The one that you're most familiar with probably is the Valium class drug. That probably is the most harmless. It's still addictive. I mean, Xanax is a drug in that class, and the initial studies for it showed that it worked for about 3 weeks. Then it didn't work for about 2 or 3 weeks, and then it was harmful for the last part of the trial, but they approved it anyway. So those things are probably the most benign. The SSRIs like Prozac, the serotonin uptake releasing, you guys are, I'm sure, not aware of this, but you've heard of the chemical imbalance in your brain theory, right? Mm-hmm. Well, that was invented in a marketing department of a drug company. That is not science at all. I mean, it's crazy. So these drugs create violence in a significant number of people, and they've been thought to promote some of the mass murders and the problems that we've had. And they definitely promote suicide. I mean, I have a friend whose husband started taking a generic Paxil for 2 weeks, and he threw himself in front of a train. And she started a group called MISSD, in honor of her husband, Stuart Dolan. And you can look that up, and you can read about the suicides that are caused by SSRIs and other drugs, including some drugs that aren't even in the psych class. Another class of drugs you guys are familiar with. You've certainly had some of your friends, or maybe you had a personal exposure to the stimulants and the amphetamine class drugs, the Ritalin class drugs. And these things work for a short period of time, but now they're passed out to everyone, and they're claiming that older people are candidates for them too. And the whole class of drugs is an old class of drugs developed well before World War II. They were used by the samurai to commit suicide or not samurai, the kamikaze pilots when they dove into the ships to commit suicide and blow up the American ships. I mean, there are animal studies that show they shrink the brain, and most of the authorities who originally introduced the idea of using this for this made-up diagnosis called ADHD have backed off and said, we have gone crazy with these things. We've gone far too far. We're damaging our kids. So that's another class. The third class, which is also used promiscuously, is called the atypical antipsychotics. Zyprexa is the first of them. And this group cuts lifespan by 10 to 20 years. Just think about that for a moment. They pass these out to people like you guys that are depressed. They try an SSRI first. If that doesn't work, they give you a little bag and put some other things in it, of maybe a little Xanax or a little clonazepam or a little Zyprexa or something, and tell you to try all three. Military people get stuck on these things, and all these classes of drugs are tremendously addictive. They don't have opioid class withdrawals. They don't sweat and have other symptoms like the opioids, but they're very hard to get off, and they have symptoms of anxiety and depression that they're originally designed to treat when the people try to get off of them. So the psychiatry is a mess, and I'm a kind of a psychiatry denier myself. I think these guys aren't critical thinkers. They haven't done good studies, and they have a field that's defined as it has no laboratory tests. In other words, they're, quote, functional problems. So we don't know anything about these entities they're treating. And the theories about schizophrenia are equally specious as the theories about depression. They say that there's another magical substance like the serotonin for the schizophrenia called dopamine. And those, it's just fabricated. It's marketing by the drug companies. And the psychiatrists got together with the drug companies and they created this thing called a DSM. You know what the DSM is? It's a big yellow book with which catalogs all the all this made up stuff, and the diagnoses get voted on every few years by a vote of this American Psychiatric Association. So it's voted, all the stuff's voted on, and then it's used as a treatment manual to put these drugs in people's mouths. And so I think, if you're desperate, you're almost suicidal, you might consider some of this stuff, but you have to realize that it might help you commit suicide. You may get up and go to do it. So anyway.
I'm curious about, on the topic of psychiatry, and I'm a big proponent of therapy, and I'm also a big proponent of psychedelics in order to facilitate healing. What do you think the future holds for us in that regard, in terms of allowing psychedelics to be utilized?
Okay. Now, Josh, you're not gonna like this, but let me kind of give you the background of what the psychiatrists have done to us, right? They have done things like lobotomy, which got a Nobel Prize, right? They'd stick a couple of ice picks in through your nose and destroy part of your brain, right? They have done things like ECT, which has been discovered to have electroconvulsive therapy, which has been discovered to have a significant death rate, and it really doesn't work. They have done shocking insulin people by taking their blood sugars down, crashing their blood sugars down. They have used cold water baths to treat psychotics, right? Well, the psychiatrists are sort of off on their own, working on people in mental hospitals. Nobody paid them much attention, and these people didn't have any rights. I mean, they've experimented on all kinds of ways with all kinds of things. And the latest, of course, are these classes of drugs that I mentioned. I mean, it's horrible. We have 17% of our whole entire populace on psych drugs. Now, of course, the psychiatrists are terrible, but they're amateurs compared to the people selling the COVID vaccine, the quote vaccine, which is looking like it's going to be the most profitable drug in history, because it, in theory, has to be given to every man, jack, and child on the planet. I mean, it's ridiculous. So, but anyway, the psychiatrists, I think it's my belief, based on not too much else, but the history, that these ideas about using psychedelics to treat depression or anxiety are yet another abuse. I'm sorry. I don't like the idea. Now, I don't have any experience with it, and I just don't think it's a good idea.
Mm-hmm.
Do you think it's because the brain's just so complicated?
Yeah.
Well, I think
we don't really understand it.
Travis, the way you should think about it is, if you're in pain, if you're depressed, there's something going on that you should recognize. And to cover it up with some crazy thing that makes you feel like a jackrabbit is not the way to go. You've got to work through it, and you got to change your life somehow.
Yeah.
And, especially young people like you guys, I mean, Jesus, you're so plastic, you're flexible. You can do anything you want. You can go 180 degrees different and improve your life.
Well, I think that I totally agree with you there. I think a lot of the times when people, you're like, oh, I have so much anxiety, or I can't concentrate. It's like, well, you're sitting in a cubicle with no windows in sight under fluorescent lights for 12 hours straight, hammering phone calls. Try doing some manual labor outside and see how you feel. Can you concentrate on that? Or try playing an instrument. Can you concentrate? You know what I mean? There's got who could concentrate working a terrible desk job in an office? I don't know how you could do that without being on drugs.
Absolutely accurate.
So I think the answer is so much more complicated and so much harder. And the way companies work is they solve problems, and that's a huge problem. Being okay, we'll go change your life then. It's I don't know. I think that this is a good segue into, what there is to do about it, because people people like Josh, who offer a service that helps people get on track with their health and fitness goals, things like that are that's kind of, it seems to me anyways, that's kind of the avenue that is really the only fix. Like, is it like personal responsibility, even though it kind of sucks that it's been put on you like that. Like, it is kind of like your personal responsibility to like get yourself educated, figure out your own health, and take control of your own health and fitness and like your health, right?
Yeah, to just stay healthy.
Agency is the key. You got to realize that you're the actor here and not someone else. Don't blame anybody else. Just experiment and change until you're better.
Yeah.
Yeah. I think when it comes to a lot of what we've talked about today, of course things happen, and of course people are going to get sick, and that's kind of just part of life, and it's an unfortunate part of life. But we've been talking a lot about treatments, and I believe that if we can avoid having to seek treatment, then we're going to be a lot better off. And the thing that people aren't talking about is, just like Travis said, just like my mission is to educate people on how they can take care of themselves so they don't need to seek treatment as often. There's a reason that America is one of the most unhealthy countries. It's because nobody takes care of themselves. So if we can teach people how to pay attention to their bodies, like you're saying, how to listen to what their bodies are telling us and how to think for themselves, then I think we're going to be in a much better place. And potentially, I don't know if that's the catalyst for change in the healthcare industry or in the government, but it's definitely a catalyst for change within every one of us.
Yeah, that's a better way to put it. It's going to take a great crisis to change these systems. They're so entrenched, the big money interests have got us. But fortunately or unfortunately, they're brewing up a big crisis. So you guys are going to live through it. Hopefully it'll happen after I'm gone. But geez. Yeah. So, I've got a couple other interesting little tidbits here. We could talk about a superstar kind of doctor, the kind that I really enjoy or I really admire, or we could talk about CPR and how that doesn't work, and ACLS.
I think to end on like a nice, good, positive note, let's go superstar doctors. We'll talk about because I think a lot of people listening to this podcast may think that we're bashing doctors and healthcare. And I don't want that to be what people take away from this episode, because there are good doctors, just like there are good coaches, there are good doctors. And so I think that would be a great thing to end on. So let's dive into that a little bit.
Okay. So, I greatly admire neurosurgeons from afar. And these guys, sometimes their personality skills are not that good, but the situations they're faced with they have to be just tough as nails, and they have to have the nerves of a combat general, right? You got to send your kids off to die in order to preserve the country or whatever it is. So I'm going to give you an example of this thing. There's a thing called a Berry aneurysm, which is a little outpouching in a blood vessel in the middle of your head. And these neurosurgeons do these lengthy operations. I mean, they're 6, 8 to 12 hours long, where they go in and they prise apart the brain tissue very gently, and they clip off the base of the aneurysm or somehow seal it off so it's not going to bleed. Now, if they don't do this, the aneurysm has a statistical chance of killing you every year that you leave it in there if it's a certain size. But if you do this, there's a 2.5% in good hands chance that they're going to kill the patient during the surgery. So the neurosurgeon, and again, this is not based on any experience. I read about these guys and I kind of admire them, and women. The neurosurgeon has to go in there with the idea that if he loses a few or she loses a few, it's not the end of their career. And they just have to be sanguine about this horrible possibility. And it takes a stronger individual than I am to do that work. And, the surgeries, I mean, I was exhausted after an hour and a half. I couldn't stand to do 4-hour surgeries. These guys do 24-hour surgeries sometimes. I mean, it's mind-boggling. So I have a little bit of stuff like that in my book just to break up all the negativity.
And my mom actually had that surgery. She had like a burst brain aneurysm in her brain. It was like a crazy long surgery, but she's still alive. She survived.
And when they're ruptured to begin with, the outcomes are much worse.
Yeah.
I mean, the outcomes are there. I mean, maybe a quarter of them end up being gorks, and a quarter of them die, and half of them do pretty well. So I don't know. They're all individual, Travis.
Yeah, it was like when we were in the hospital at the time, they were like, yeah, there's like a very high chance that this doesn't go well.
that
she's gonna die in surgery, but they did it. And that's what I mean is like, it was like 4 a.m. in Boston. This dude gets up out of bed, comes, throws his shit on, and does this insanely long surgery where he's got like a 50% chance of, killing my mom, and has to like tell me that to my face.
Yeah.
And he crushed it. And, he just came in like, so there are those people, and like, that's amazing. And those
real
people,
physicians with a capital P.
Yeah, exactly. Like he just came in and he was like, listen, like I've done 4 of these in the past like few days. He's like, I'm really good at this. I got this, but there's like a huge chance that it goes bad. And, and he crushed it. So, good on those guys.
And that's gotta be terrifying. Both for you and, Robert, what you were mentioning of just the type of individual that it takes to accept that responsibility so often, and to make a career out of, wanting to help people so badly, and understanding that there's a great chance that you're going to fuck up a lot.
They're a little crazy too, Josh. Their personalities are warped by the whole thing, but you got to have those guys around. Otherwise, what are you going to do? Yeah.
The world needs people like that.
Yeah.
Yeah. Sure. And that being said, I'm sure, to elaborate on that and expand upon that a little bit, it's like, there are those people, like you said, physicians with a capital P, that exist in every field.
Yeah.
And, when we're looking for someone to help us with a problem, we want to be able to have options. And that's part of why I always choose the healthcare that I do, is so that I can have options. I don't want to be told who to go to. I want to pick who to go to. And I'm always, and I have always and always will, look for the physician with a capital P in order to help me. Because I mean, that's one of the great things about our healthcare system, is that in many ways we can choose. We just have to be able to do the work.
You can judge doctors just the way you judge an auto repair guy. I mean, you can sense integrity and so on and so forth. I mean, sometimes it's a little harder because what they're doing is so technical, but you don't want to let go of your credulousness, or allow yourself to be taken in. If your feelings are not good about the situation, it's easy to switch in America generally.
Mm-hmm.
Yeah.
Yep.
And like super important, like I wouldn't hire just the first electrician I saw to do a big job on my house. I'm going to talk to a few of them at least.
You got to shop around a little bit.
Yeah.
But man, I think I hope that this conversation, for the people who are listening, I hope that this conversation was valuable and eye-opening. I hope that it encourages you to look a little bit deeper and expand your knowledge and ask questions. And when you need help, I hope it encourages you to look around and shop around, and, like Travis said, not hire the first electrician that you see.
And we're also trying to sell a few books.
Yeah.
Now, I don't make any money. I make no money.
Book here, Robert.
I make no money on this. I mean, it's absolutely a loser for me, but it's satisfying. And at 68, I'm just trying to contribute. Mm-hmm. And it's my website is robertyohoauthor.com. robertyohoauthor.com.
All right. So we can send people there. Are you anywhere else? And they can they download the book there or buy the book there?
Josh, I'm 68. I don't do social media. I don't know
on TikTok.
No, I'm not on TikTok yet. People tell me to do it, but I'm messing around with this. I do a podcast a day, and I do Amazon ads, and I asked my advisors whether I would do something else, and they said you're too busy already. And so
yeah. You want to do TikTok?
We'll have the book link in the show notes and everything, so you can just go down there and click on it.
Yeah, Thank you, Travis. You can get half of the audio for free on my website. It's on YouTube, and it's also on a podcast. Half the audio is on a podcast. So if you want to listen to half of it before you buy it, you can do that. Also, you can download half of the book from links on robertyohoauthor.com.
All right.
If you want the whole thing, you got to go on Amazon or find another source. It's on virtually every place that books are sold.
Cool. All right. That's good to know. So everybody, I highly recommend check out Butchered by Healthcare by Robert. And then next time I'd really like to hear more about hormone secrets. So I'm sure this isn't the last time that we're going to chat, but in the health and fitness industry, I'm fascinated by all things internal health, including hormones. So I highly recommend everybody check it out. And then Robert, we'll have some clips for you to share. Wherever you decide to share them is up to you. Yeah, right. We'll make you a TikTok. We'll put them up there. Yeah.
If you want to do that, you can do that. I mean, I don't know who. I guess you just link them to my website, right?
Yep, we could do that.
That'd be very kind of you.
Yeah. All right. Well, thank you, Robert, for your time. I appreciate the conversation. Thank you, everybody, for tuning in to another episode of the Struggle to Strength podcast. We will see you guys next week.